dyspepsia, etiology of dyspepsia, that is the intolerance. In addition to the various pathology, inflammatory process in the esophagus, gastritis, that is the dilatation or the looseness of the lower esophageal sphincter, which produces the GERD. GERD is the regurgitation of the gastric acidic content into the esophagus, which produces inflammation, strictures, stenosis in the esophagus pipeline, or that is just like a pipe or a tube one, which convey the food stuff chewed by our teeth in the buccal cavity onwards into the gastric cavity or gastric sac. In addition to these factors, there are other risk factors, that is excess use of alcohol, excess smoking, that is the action of the nicotine, excess intake of the coffee and the related beverages that produces caffeine. These also produces these symptoms of the dyspepsia. The other cause, that is the pathogens which causes the symptoms of dyspepsia, that is H. pylori, Helicobacter pylori. This is a pathogen which produces inflammatory disease in the stomach and the intestine, that is the small intestine into the duodenum, jejunum, ileum. So this also produces the symptoms of the dyspepsia. So the investigation, as far as functional dyspepsia is concerned, no investigations are required, only the history of the patient and the physical examination of the healthcare provider, that he has to inspection, palpation, auscultation in the any lump formation or mass in the abdominal cavity, especially in the upper abdominal area and in the epigastrium, especially the lymphoadenopathy, that is enlargement and swollen lymph nodes, which produces indication for infection in the abdominal cavity. So the detection of the H. pylori needs a careful treatment. For that, we have to perform the blood test to detect the, ensure the infection of the and presence of the H. pylori pathogens. For that, we mostly use the antibiotic clarithromycin, azithromycin, amoxicillin in the form of oral or systemic therapy, along with other adjuvant or the associated medicine or the therapy, that is the metronidazole in the form of oral or in the form of drip, the IV therapy, along with antispasmodic if there is pain due to the colicky pain in the epigastrium or in the upper abdominal region, especially due in the pancreatitis and the cholecystitis, which are very severe, produces severe abdominal pain, and that needs the the antispasmolytic treatment in the form of IV therapy. So for that, we have to adopt the medical treatment for the the organic as well as the functional dyspepsia under 50 years patient. But those persons who are above 50, elders ones, and they are presenting alarm symptoms, severe pain in the epigastrium or the upper abdominal area, there is a mass or swollen area in the upper abdominal region, and then there is hematemesis, melena, there is loss of appetite, loss of weight, and also early satiety. These are the alarm symptoms. In this, symptoms are the group of symptoms. For that, we need a careful and the electronic investigation by the upper GI endoscopy. So endoscope is a device fitted with the light as well as video camera that is passed through the oral cavity, through the esophagus and onwards into the upper part of the intestine, that is the small intestine. So by means of this device we can visualize any pathology producing obstruction or the pain or the bleeding in the stool or in the vomitus. Whether it is a tumor, whether it is ulcer, whether it is chronic inflammation producing stenosis or the ulceration or the stricture one in the GI tract, which produces the pain and the various nausea, vomiting, and these are symptoms which are called as dyspepsia or the indigestion problems. So this is done only for the patient who are above 50, whereas those patients who are under 51, they need only medical treatment and the generalized simple laboratory investigations, that is ultrasound of the abdominal, ultrasound and CT scan, and mostly afterwards if there is some severe another case, then we can also be MRI can be done. So, but the endoscopy we only perform when the person below 50 produces alarm symptoms. So we have to perform the endoscopy, upper GI endoscopy. So blood CP, the CP or the C, complete blood count is done to detect the anemia, that is count of the RBC, HB percentage. So these are the ESR to detect the degree of the anemia, and mostly it is iron deficiency anemia and vitamin B12 anemia which produce in dyspepsia. Now we proceed onwards to the treatment and management of the dyspepsia. For preventive measures, plenty of water, avoid spicy and the fried diet, that is which are the fat laden, saturated fat laden food stuff. So these are basic things we have to adopt for the avoidance of these dyspepsia. Mediterranean diet, that is vegetables, green leafy vegetables and the fresh fruit, plenty of clean pasteurized water, have a regular exercise, morning exercise. These are the basic things to avoid the complication of these symptoms. Now, antacid drugs that contains aluminium and magnesium trisilicate compounds, they are used to reduce the acidity in the gastric contents. Next is the H2 antagonist, that is a group of medicine, cimetidine, famotidine and ranitidine. These are the three groups of the medicine which are used in the form of tablets or the syrup forms. Next is the PPI, proton pump inhibitors. It also consists of a group of medicine, that is esomeprazole, omeprazole, pantomeprazole, lansomeprazole. This is a group of medicine which are used to maintain the acidity and also the function of the gastric and the enzyme systems in the small gut. So these are the basic and major steps to reduce the symptoms of dyspepsia